Hi guys, my name is Pip and I work at Sydney Advanced Physiotherapy. Most people don't know how to squat well, and when we first start assessing people's squats when they come in and see us in the clinic, there's often a few things going wrong. So if you can't squat well, you're not getting the benefit of doing that exercise, and sometimes people are actually making things worse because the thing that they're doing when they're squatting can be pretty interesting. You can easily irritate your knees or your lower back doing squats, so it's really important that you try and do them well. So what I thought I would do is make a 4-part series and take you through a lot of the steps that we go through with patients in order to get their squat working well. And the reason I'm not making this one video is because there's a lot of instructions, and if you try and do all of these things all at the same time, having never done any of them before, it's too much. As you get better at doing these squats, then you want to try and take the next lot of tips and layer them on top of what you've already been doing. As always, the instructions in this video are intended as general advice only. If you're going to try and do these squats at home, you are doing so at your own risk. If you feel any pain, discomfort, pins and needles, or any numbness at all, I recommend that you stop immediately and consult either your physio or your GP. The first part of getting a squat right is to set your feet up hip distance apart or slightly wider. Place one hand on your lower rib cage at the front and the other in the curve of your lower back. As you sit back into the squat, try to do it like you're looking for a chair. So you're sitting back. Use your hands to feel for any movement in the spine. Your spine should not have any hinging movements, nor should your bottom tuck under and round your lower back. Try to keep roughly 2/3 of your weight on your heels as you squat. If you normally walk around with a large percentage of your weight on the front part of your feet, then you might find this challenging to control your balance, so gradually increase the amount of weight on your heels. You want to squat like you're looking for a chair and maintain nice alignment from hip to knee to foot, making sure you don't weight shift off to one side and that your knees don't roll in. Once you get the hang of this, you don't need to keep your hands on your ribcage or on your spine. You can just control your spine by feel. You can then put your hands on your hips out in front of you or just relax them beside you. You want to try and breathe out on the way down and in on the way up. So breathing out on the effort and in on the return. I hope you've enjoyed this video, which is one in a series of 4 about things that you can do to get your squat technique better so that you don't struggle doing squats and so that you get the maximum benefit from the exercises that you're doing. If you struggle to get the hang of the squat at any phase along this series of 4 videos, then it really is time to go and see the physio to get some help. You can book in to see one of our physios online via sydneyadvancedphysio.com.au, or you can call 9416-4410. Please let us know below in the comments if you have any questions or any other videos you would like to see, and thank you so much for supporting Sydney Advanced Physio on Patreon.